Good afternoon and good morning if you're on the West Coast. I'd like to welcome everyone to our monthly webinar. Today's webinar is titled Taking Physical Activity Beyond the School Walls, and our special guest is Dr. Jim Sallis. My name is Peter Cribb, and I'm the National Director for the CATCH program with the Michael and Susan Dell Center for Healthy Living at the University of Texas School of Public Health and the Austin Regional Campus. We're very excited about today's webinar, but before we get started, I would like to take care of a little housekeeping. First of all, our webinar today is being recorded and an archive will be made available on the catchinfo.org website, along with a PDF of the presentation slides. During today's webinar, we encourage you to type questions and comments via the questions box, which you can access through the control panel on your screen. You can type in your questions at any time, but to keep us on schedule, we will try to hold off answering them until the Q&A portion at the end of the presentation. Next, I'd like to share a little about the Michael and Susan Dell Center for Healthy Living. We are an international leader in conducting research and providing programs that promote healthy living for children, their families, and communities. Our mission? To advance health and healthy living for children and families through innovative research, cutting-edge community-based programs, and dissemination of evidence-based practices. Our vision? Healthy children in a healthy world. You can find out more about the Center and our work in school health on our website, www.msdcenter.org. I'm now delighted to introduce our special guest for today's webinar, Dr. Jim Sallis. Dr. Sallis is a distinguished professor of family medicine and public health and chief of the Division of Behavioral Medicine at the University of California, San Diego. Dr. Sallis was one of the original investigators for the first CATCH trial in the late 80s. I first met and worked with Dr. Sallis in New Orleans in the early 90s. He was pilot testing a self-administered physical activity checklist called SAPAC. My responsibility was keeping the pencil sharp. Dr. Sallis has worked with multiple agencies and has written extensively about community youth physical activity promotion. He's one of the world's most cited authors in the social sciences. Thanks so much for joining us today, Dr. Sallis, and welcome.
Thank you, Peter. My pleasure to be here, and it's a very good idea and great to have this opportunity to speak to this wide audience while I'm here in Austin for the Scientific Advisory Council for the Dell Center for Healthy Living. So we'll just get right into this. I thought it would be useful to talk about some additional ways of getting youth active outside of school or outside of the school day, which we have focused on for many, many years. And so I'm just giving my website here in case anybody wants to look up other things that I and my group have been doing over the years. So we'll just get right into this. So here's an outline of what we're going to focus on, just a little bit about the prevalence of youth physical activity and inactivity. And then I want to just give some examples and evidence related to community-based strategies to increase youth physical activity. So we'll talk about active commuting, and that's what that little tyke is doing, let's say, on the streets of Washington, D.C., surprisingly enough. They've created a lot of bicycle infrastructure there. We'll talk a little bit about shared use agreements, after-school programs, focusing on youth sports and dance classes, and just a little bit on park design. And then I am director of the Active Living Research program as well, so I just want to highlight a few resources that we have. So we'll get started. These are data from the NHANES, the National Health and Nutrition Examination Survey. the first nationwide study of physical activity across the age range using accelerometers, so to get objective measures. And I would say that there's not a great consensus on how to score these data, so there are different ways of looking at it. But the data that were published a few years ago show that in the best case of elementary school age boys, fewer than 50% were meeting the guidelines of 60 minutes per day. And you can see that girls were less active at 35%. And then when you get into the middle school and high school range, you have 10% or fewer meeting the guidelines. So as we all know, children in the U.S. are not nearly active enough to meet the guidelines. But let's put this in a bigger context. Here are data from 10 countries worldwide, mostly in Europe, but a few other places. And this is the average number of minutes that these children were active based on accelerometer data. And I've circled the data point for the United States, which just happens to be the lowest of any of these countries. And in fact, it's at about 45, 46 minutes. It's only about half of the highest country, which is Norway, with 84 minutes. So even internationally, it looks like the United States children need to be much more active. So what can we do? Well, there are many things that we can do. And of course, we won't forget about the many evidence-based school-based strategies, but we're going to focus on things really outside of the school day. And so we're going to start with children walking to school. And so we don't see an awful lot of this in San Diego, where I live. So I happen to see this in Norway. So where very active kids are, and here are a bunch of them walking to school. So this is what's happened in the United States from the 60s to the 2000s. In the 60s, about 50% of children usually walked and biked to school across the K through 8. And as you can see, the red bars show that that went down to about 12 or 13% as of 2009. So a big decrease in this type of activity. The good news is that we are working on getting kids to walk and bike to more. And is this important? Well, I think so. Here's a study from Denmark showing that kids who walk and bike to school are less likely to become overweight. So if you look at the red bar for walking, they were about half as likely to be overweight as those who ride to school on a bus or in a car. And cycling, they were about 40% less likely to be overweight. So this is important information about the need for children to walk and bike to school as one means of keeping their weight healthy. So for some years, for just a few years, we've had funding from the federal government for Safe Routes to School grants. That's SRTS. And I'm just showing you one evaluation of Safe Routes to School grants from the federal government in 5 states. And here's the types of things that were done with those grants. All of these grants had physical projects, so changes that were made to the neighborhood. These grants can also be used for hiring crossing guards or encouraging kids to be active. But for physical projects, the most common thing that was done was building or improving sidewalks. The next was improving crosswalks, and then improving signage. So these are basic things to keep kids safe. I think you would expect these to be very reasonable things to do. And if you don't have a sidewalk, then building one makes a lot of sense if you want to encourage kids to walk to school. So these are the types of things that were done. And what was the effect? So across all of these schools in 5 states, walking at the beginning before the project was less than 10%, and it increased to about 14%. Bicycling was much lower, just barely over 2%, and it increased a little bit. But overall, these projects increased walking 40%. This is good evidence that these programs are working. One other study looked at these projects over quite a few years, and found, if you look at the left side of the grant, before Safe Routes to School funding, the walking and biking was about 18%, and then for each year that the project was in place, more children are walking and biking, up to over 30% after 4 and 5 years. So this shows that the impact of Safe Routes to School projects increases over time. So this is funding from the Transportation Department, that working with schools to get kids healthier. So this is an example of a multi-sector approach to getting kids more active. That appears to be working, so that's really good news. Another aspect of Safe Routes to School is walking school buses. This is a study that was done in Texas, and basically shows that walking school bus after 4 to 5 weeks, the active commuting to school, or ACS, increased from a little over 20% to over 50%, whereas in the control participants, it declined. So walking school buses, it looks like, can be a useful component of a broader Safe Routes to School strategy. Shared use agreements. These are generally either formal or informal agreements between schools and other agencies. And so that could be a parks department who would come in and run programs. It could be a sports league that would use the school grounds for sports after school. So there's a couple of ways that you can do this. So you see the photo on the left is basically locking up the school after the school hours, keeping kids out, and the one on the right shows that this schoolyard is open for public use. And so there's a little evidence that youth are more likely to be physically active when they have access to fields and play areas after school. So there's a lot of interest in shared use agreements, but not much evidence. But the California Center for Cities and Schools has surveyed schools that have done shared use or joint use agreements, and they've identified some lessons. So the first one is that there has to be a sustainable and trusting relationship between the school and the partner, and this may take some time to develop. A lot of times there are liability concerns, and these are more perceived than real. There are almost no examples of big lawsuits against schools who have opened up their grounds for physical activity. And then shared use partnerships really need to address local needs. So there's not one type of agreement that works for everybody. It really needs to be tailored for local needs. The other thing I wanted to highlight here is that the Center for Cities and Schools has a shared use calculator, so that you can go on to their website and make estimates of how much these things might cost for maintenance or that sort of thing, and depending on the size of the school and the type of relationship. So I encourage you to go take a look at that. So here's a brand new study that was just published in December based on a national survey. So this study done by the Bridging the Gap group surveyed over 50,000 8th, 10th, and 12th grade students in over 460 school districts. They coded the joint use policies for content. And one of the things that they found, if they just compared schools that had a joint use or shared use policy and those that did not have a policy, there was no difference in the students' reported physical activity. However, they found that specific aspects of the policies were related to physical activity. So if the policies specified the times that the facilities were available for use, and they specified exactly which facilities were available for use, then schools with those very specific policies, their students reported more physical activity. So it looks like we need to pay attention to the details of those shared use policies. So evidence is just starting to come in on shared use policies, but it's certainly something worth pursuing. Here's an example of I would say, a more extensive use of shared use policies. And this is the Learning Landscapes project in Denver, Colorado, run by Lois Brink, who is a landscape architect. So what they did is they went into low-income schools in Denver, and you'll see the before pictures on top of some of the school grounds. And they really don't look like school grounds. They look like abandoned neighborhoods, but that's what these school grounds look like. So what they do is they raised money, and then they brought in the community to help redesign these schoolyards and open them up as community parks. So they became, instead of closed to the public, open to the public, with the community welcomed in as co-designers. And look at the photos on the bottom of what these turned into. Complete transformation, and they conducted research to show that, not surprisingly, children did more physical activity in the renovated playgrounds. So that's certainly a great model. And one other thing about shared use, we at Active Living Research on our website, we do have a brief summarizing research on this topic. Okay, let's go to after-school programs. We also have a brief on summarizing the research on this topic at Active Living Research. And here's a couple of quotes. A comprehensive review of 13 physical activity interventions conducted across after-school programs found the amount of time children spent in physical activity during the after-school program increased by as much as 17% after the interventions. So that sounds pretty good. But on the other hand, the 17% was the high end across these studies. Here's another set of results. The effectiveness of programs designed to increase children's physical activity within after-school programs is mixed. Some programs have decreased the amount of time children spend in moderate to vigorous physical activity, and others have shown modest increases. So I think the scientific literature shows that even programs designed to increase physical activity after school, not all of them are successful. So there's certainly many opportunities to improve physical activity after school, but you really need to continue to evaluate the programs to make sure that children are getting more active. So let's take a look at two examples of after-school activities and see why after-school programs may not be as active as we would expect. So these are a couple of studies that our group has done. And one was about physical activity during youth sport practices. So this was published a few years ago. And certainly participating in sports is a common way for children to meet physical activity guidelines. But it's important for parents as well as program leaders to have an idea of how much activity children are getting during sports. So in this study, we evaluated the minutes and intensity of children's physical activity during soccer and baseball practices, because we figured that soccer would be on the high end of activity and baseball would probably be on the low end. And this is what we found. So one way we looked at the data was the percent of these 8 to 14-year-old children meeting the full 60-minute per day guideline during youth sport practice. And for boys, you see that they're 30 to 35% were meeting the guidelines. And interestingly, for boys, those levels are similar between soccer and basketball. So those boys are doing a fair amount of activity. If you look at girls, there's a different story. So even during soccer, the girls are less active than the boys, less likely to meet the guidelines. And in baseball, virtually none of the girls were meeting the guidelines. So in girls softball, I think we've identified a pretty big problem of not getting very much physical activity. So we think that there's a big opportunity to improve physical activity during youth sports. And so we would certainly encourage the practitioners out there to do some measuring of their own programs. Another study that we recently conducted was similar in looking at physical activity in youth dance classes. So this is a study that is a paper that's currently submitted for publication. So again, dance is a popular activity, and particularly for girls, but physical activity in class is seldom studied. So we just studied girls in dance classes so that we could understand this special opportunity for girls, because girls in virtually every study are less active than boys. So we studied 7 types of dance classes in 17 private studios and 4 community centers. We had 264 girls in all in 66 classes, and we analyzed them separately for children and adolescents. So overall, these youth were getting 17 minutes of moderate to vigorous physical activity, again assessed by accelerometer. And this was only about 36% of class time. So, so that's a lot of class time that was not active. So that's one way to look at that. And then if we look by age and by type of dance, we see that overall, children in the dark bars are getting more activity in each type of dance class except ballet, and that there's a big range across dance types. So you see the children are getting the most activity in hip hop and partner dance and jazz. So and they're getting about 20 minutes or more, which again is not even half of the daily recommendation. Adolescents are systematically getting more, and interestingly, adolescents in ballet are getting the most physical activity of any dance type. And for some reason that we're not really sure about, Latin and flamenco dance are the least physically active. So this, we think, might be interesting information for parents, so that they can maybe direct their children into more active types of dance. All right, we'll just finish up with a little bit on parks. A couple of things about parks. One is that there are several studies showing that children who live near parks are more likely to use them and more likely to have higher physical activity. So that's the good things about parks, that they do help children be more physically active. There's a difficulty with parks, though, in that not all neighborhoods have parks, and that there are disparities in access to parks. And that shows up very clearly in this study from several years ago, where you see that the vast majority of African American and Hispanic neighborhoods do not have parks in them, whereas the majority, about 65% of mostly white neighborhoods, do have parks nearby. So this is a very important public health message to advocate for parks in all neighborhoods, especially those serving neighborhoods with vulnerable populations. But if you have a park in your neighborhood, then you want to look at what's in that park and how it's designed. Here's a very interesting study where they measured physical activity by systematically coding physical activity in every zone of parks. So this was a number of parks around Chicago. And you see there's a range in the amount of physical activity that they observed in these parks. So the highest physical activity was in playgrounds and basketball areas. The lowest activity was in just open space, and then softball and baseball areas. Well, of course, softball and baseball is not a particularly active game, and you've probably got more people sitting and watching than actually playing. So softball and baseball fields tend to be very large areas that don't generate much activity, as opposed to basketball areas that don't take up much space but can generate a lot of activity. So we're now getting evidence that's helping us figure out how can we design parks and use space efficiently to give a lot of activity options for a variety of people. So let's summarize and state some conclusions. So the Centers for Disease Control recommendations are for youth to obtain at least half an hour of moderate to vigorous physical activity during school and half an hour of activity outside the school day. So I've shown you new evidence that Safe Routes to School programs are effective for the 1/3 of students who live close enough to walk to school. Now, much work is needed, as we saw, to improve physical activity in after-school programs, including popular options such as youth sports and dance classes. We have emerging evidence on the role of parks in youth physical activity and how to design parks to be more active. We still need more evidence about the effectiveness of shared use policies. We're very early in the evidence there. But overall, there are many options for youth physical activity outside of school, but more work is needed to optimize their effects and ensure equitable access to activity options. So my final message is to ask you to please be an advocate for policies and programs to increase youth physical activity outside of school, as well as the work you're doing to promote activity during school. And as I promised, I just want to show you a few of the resources that we have at Active Living Research. We have these research briefs that summarize research in a non-technical way. So here's briefs on parks and playgrounds, on trails, on economic benefits of open space, on the equity of access to recreation facilities, and shared use. And we also have a number of infographics about a lot of these same topics, as does the Dell Center for Healthy Living. They have a lot of infographics too. So with that, I think I will sign off, and let's see what questions we have.
Great. Thanks, Dr. Sallis. We do have a question straight up, and this is from Sarah Morgan. And this is about the soccer baseball study you were referring to. Were the girls and boys in this study, was it a co-ed practice or were they separated practices?
These were all separated by sex. And so the girls were playing softball, not baseball. So they were definitely separated by sex.
So we had no gender bias going on there.
No, it wasn't the boys shoving the girls out of the way, which we sometimes see. And these were community programs, so they were fairly low level competition, not high level competitors.
Great. I encourage folks that have a question for Dr. Sallis, now is the time to type that in on your screen. Dr. Sallis, you mentioned about the after-school programs, and that quite a lot of the students aren't getting the physical activity that perhaps they should be. Is there any strategies or techniques you might suggest for maybe upping the ante there on the physical activity side?
Well, yes, of course. One of the things that we think needs to be done is to bring after-school providers into the public health realm, because most of them in dance, maybe they're not really thinking of this as a physical activity program. They're thinking about, well, this is just recreation, or we're building skills for professional dancers. And we would like them to think about how can you optimize the effect of your program on public health while also meeting your other goals. And this is really the same message that we've been bringing to physical education professionals for decades now. Yes, physical education needs to do multiple things, but it also needs to contribute as much as possible to public health. So I'm involved in a little group working with the Institute of Medicine, and we're planning a webinar on physical activity in community youth programs. And so I'd encourage you to go find the website on the Institute of Medicine Roundtable on Obesity Solutions and look there for an announcement about a webinar in the coming months. It's not scheduled yet, where we're going to invite people involved in after school and other types of youth community programs to think about how can they engineer their program or set goals to make them contribute as much as possible to public health.
Great, thanks. Yeah, a few months ago I had the privilege of going with Dr. Andrew Spring. He had a project on physical activity down in Uruguay. And as I was looking at your learning landscapes picture, unfortunately, the first was very true. That's what I was seeing. We have a question from a listener out there right now. They're asking, is there any funding available for learning landscapes? If so, where would one go for that?
Yeah, I would look at local foundations. That's an interesting part of the learning landscape story, actually. They had funding from a local foundation in Denver to convert, I think, 48 schoolyards into these learning landscapes. And there was so much interest because people could see these transformations across their neighborhoods that they put this on the ballot for a bond issue and passed something like a $50 million bond issue in Denver to transform all of the schoolyards in the city to these learning landscapes. So I would say start working with local foundations and then think big about what can be accomplished in your area.
Jim, we had another one from Patty, and she's asking, who pays for after-school programs, and how do we get it done? Is it this, and how do they do it?
Yes.
How do they do it?
Well, there are many different models for how after-school programs operate. And some of them are operated by park and recreation departments, and they're hopefully free or on a sliding scale. Many of them are Many of them are operated by the YMCA or Boys and Girls Clubs, and those certainly are on sliding scales, so that makes them accessible to many, many kids. Some of them are more private, like the private sports leagues, and so who pays? The parent pays. And some are sponsored by the school. And some of those would require payment and some would not. So there's many different models. This is an area where it's very important to take steps to make these as accessible to every child, regardless of income, as possible. So I would encourage listeners to get involved again with local foundations or even corporate sponsors to support some of these programs so that they are widely available.
Well, thanks so much, Dr. Sallis. We've run out of time right now, and if anybody else has any questions, we'll be pleased to vet them here and then send them on to you if you don't mind.
Sure.
That'd be great. Thanks again for all you've done, really over decades of helping to get our youth, you know, the little ones, and you know, as they get older, active for all their lives, not only here in the United States, but all around the world. We really appreciate it.
Thank you. So much. Happy to be with you today.
Great. Until our next webinar, please take care and travel safe.